Welcome back to Have More Babies. We're the show that aims to get you up to speed fast on really critical topics. And today, our mission is to take a close look at something absolutely fundamental: pediatric immunization and all the health services that kind of ramp around it to keep kids safe.
Yeah, it's a great topic. We've got some really good source material here that covers, not just the shots themselves, but the whole setup, the logistics of children's healthcare, especially thinking about the North Georgia area.
Right.
It gets into the people involved, like nurse practitioners, Crystalline J. Prothero and Cassandra Carter, ensuring that continuity of care. And also where care happens, places like Roswell, Alpharetta, Milton. It's about pulling out the key facts for you.
Okay, great. So let's unpack that.
Yeah.
When you talk about kids' health, the starting point has to be immunization, right?
Absolutely.
We can define it pretty simply. It's the process, usually with a vaccine, that makes someone immune to an infectious disease. But that definition feels a bit dry,
Yeah.
doesn't really capture the huge impact.
No, exactly. It's way more than just a medical thing. It's foundational to public health. And what really jumps out from the sources is this idea of three sort of pillars explaining why vaccination is so critical. It helps frame the why beyond just protecting your own child.
3 pillars. Okay, tell us about those. Because I think, like you said, most people just focus on the first one.
Yeah, probably. So pillar 1 is the most obvious: individual disease prevention. Simple enough, stopping potentially deadly or really serious diseases in your kid. Straightforward.
Right.
But the second pillar, that's where it gets broader. Community safety. Herd immunity, basically. Protecting the vulnerable people who can't get vaccinated. Think tiny babies, too young for some shots, or kids with immune system problems.
Ah, okay. So my choice directly impacts them.
Massively. Your decision creates ripples. It makes it almost like a civic responsibility, not just a personal health choice. Your kid getting protection helps shield someone else's kid.
Huh. Never quite thought of it exactly like that. That's powerful.
It really is. And then there's pillar 3, which sometimes feels a bit like ancient history, but it's always relevant: eradication.
Like wiping a disease out completely.
Exactly. If enough people are immune, the disease just peters out. It runs out of places to go. Smallpox, gone globally, thanks to vaccines. Polio, we're still fighting that battle right now. The idea that we could actually eliminate a disease forever, that's what makes immunization probably the biggest public health win in history.
Wow. Okay, putting it that way definitely changes the perspective.
Right.
So thinking about the common vaccines that build this defense, the ones most parents know from the schedule, we're looking at things like MMR for measles, mumps, rubella, and DCAP, that's diphtheria, tetanus, pertussis, and polio. These were, really scary diseases not that long ago.
Terrifyingly common, yeah. And the vaccines are incredibly effective. But naturally, parents worry about side effects, the immediate reaction. The sources are smart to tackle this directly. They point out that minor temporary side effects, totally normal, expected even. Things like a low fever, maybe some soreness where the shot went in, or the baby being a bit fussy or irritable for a short while.
And it's important to understand these aren't signs that something's wrong, are they? It's the body doing its job.
Precisely. It's proof it's working. The immune system is kicking into gear, building those antibodies, developing that resistance. It's like the immune system flexing. Knowing that helps parents handle that temporary discomfort with, confidence instead of worry.
Okay, that sets the foundation, the shield. Now let's shift gears a bit because, as the sources show, good pediatric care is so much more than just the vaccine schedule. It's this whole comprehensive picture, not just stopping sickness, but promoting overall health.
Yeah, absolutely. When you look at the full list of services they talk about, it really shows a commitment to covering all the bases, meeting diverse needs. You've got sort of 3 main buckets. There's acute pediatric care, that's for the urgent stuff, when your kid gets sick suddenly. Then preventative pediatric care, which is all the well-child checkups, screenings, developmental checks, and yes, the immunizations fall under this.
Right, the regular visits.
And then, crucially, there's essential after-hours pediatric care.
Oh, that's huge. Especially for working parents, right? Kids never seem to get sick during office hours.
Never. Fevers always spike at 8 p.m. on a Friday, don't they?
Exactly.
So having solid after-hours care means parents aren't stuck choosing between, say, an expensive ER visit where they might not see a pediatric specialist, or just waiting it out till morning, which could be risky. It guarantees that kid-specific advice is there when you really need it.
Okay, so that covers the main types. But here's where I thought it got really interesting. Beyond the standard sick and well visits, the sources list some specialized services. Things that really show they understand what families need today, like lactation services, massive support for new moms,
Huge.
and obesity medicine for kids, which is tackling a really tough, growing health problem.
Yeah, those specialized services really lift the practice beyond just basic primary care. It becomes more like whole family support. But a couple of others really jumped out at me as being about unique convenience and, importantly, safety.
Which ones?
Medical ear piercings and newborn circumcision.
Okay, ear piercings. Why would a pediatrician's office do that? Is that common now?
Well, it's all about safety and professional standards, really. Doing it in a sterile medical setting, you avoid the infection risks you might get elsewhere. You ensure it's done correctly with the right materials. It minimizes pain and risk.
Ah, okay. So it's convenience, but mostly about doing it safely.
Exactly. And they even mention that kids who aren't regular patients can book just for that service, which kind of highlights that focus on providing a safe community option.
Gotcha. And the newborn circumcision detail that the pediatrician does it after the baby leaves the hospital.
Yeah.
Why mention that specific timing?
That's really key for parents planning things out. Sometimes it's done by the OB right after birth in the hospital, but doing it post-discharge with the pediatrician means it's handled by the doctor who will manage the baby's ongoing care.
Okay.
It allows for a scheduled procedure, maybe with more focused pain management than in a busy hospital setting right after delivery. Gives parents a bit more breathing room to plan. And of course, they also handle the routine stuff like sports physicals for older kids.
Right. Need those every year for school sports. So all this great care really depends on the team providing it, doesn't it? The sources seem to emphasize the staff depth.
They do. They make a point of mentioning specific nurse practitioners like Christine J. Prothrow and Cassandra Carter and other staff like Chantalise Dickey. It signals that you're getting continuity. Even if you see an NP, it's someone who's part of that core team, familiar with your child's history.
Building that trust over time.
Absolutely. Pediatric care runs on trust and familiarity. Knowing you have a consistent team means things are less likely to get missed as your child grows.
Okay, so we've got the shield immunization and the whole support structure of services. Let's bring it into brass tacks for the listener. If you're a parent, or gonna be one, in Georgia, how easy is it to actually access this kind of care?
Right, the practical side. And this is where the sources give us some good insight into logistics. Instead of just, one or two addresses, they talk about a really broad geographic reach. Extensive coverage across North Metro Atlanta.
Right.
They mention serving key areas like Alpharetta, Roswell, Milton, but also reaching out to surrounding communities, Marietta, Kennesaw, Duluth, Dunwoody, Smyrna, Canton, Woodstock. Quite a wide net.
So they're trying to be convenient, basically, wherever you are in that general area.
Seems like it. And it's not just about their office locations. They also list connections to major regional hospitals. Knowing where your pediatrician can admit or refer is important. They specifically name Wellstar North Fulton Hospital, Northside Hospital Atlanta, and Emory Johns Creek Hospital. That signals good integration with the bigger health system.
And the other big piece of accessibility is always insurance. That can be such a barrier. What did the sources say about that?
Yeah, that's often the trickiest part. They seem very focused on trying to lower that barrier by accepting a really wide range of insurance plans. It's not just one or two big names.
Yep.
They list major ones like Blue Cross, Blue Shield GA, Cigna, TRICARE, which is crucial for military families, Humana, the state's Peach Care for Kids program, United Healthcare, and they say, among many others. The clear message is, they've tried hard to make it likely your insurance is accepted.
That makes a huge difference for families. And finally, one last practical thing they seem to cover is paperwork. The headache of forms for school and everything else.
Oh yeah, the bane of every parent's existence. They actually provide resources directly.
Yeah.
Things like the specific forms Georgia requires for school enrollment, they have them available, saves you hunting them down.
Yes.
Plus, specialized screening forms, like for autism or ADHD, it helps parents be proactive.
And they even get into specific medical how-tos.
Yeah, which really shows that commitment to daily support, I think. They mention pointing families managing chronic stuff like asthma towards resources like the CDC guide on using an inhaler correctly with a spacer. That's practical help beyond just the office visit. It's like a partnership.
Okay, this has been super helpful. So to wrap it up quickly, the foundation is immunization, MMR, DTaP, polio, that crucial shield. But it's supported by this whole framework of pediatric care.
Right.
Everything from after-hours help to specialized services like lactation support or medical ear piercing, plus the practical stuff like wide insurance acceptance and help with forms. all aimed at being accessible across North Georgia. Now, if you want more details on any of this, the full immunization schedule, what's covered in acute care, or that complete list of accepted insurances, the place to go is omegapediatrics.com. That's O-M-E-G-A, pediatrics.com. Make sure you visit oregapediatrics.com right now. It's your main resource for everything we've talked about.
Yeah, definitely check that out. And, thinking bigger picture for a second, all this effort that goes into preventative pediatric care, the detailed services, the team, the accessibility, it's really an investment, isn't it?
Yeah, so.
It's an investment that pays off over a child's entire life. Good care early on sets the stage for better health outcomes way down the road. It truly compounds. So please, if you found this useful, like this video, subscribe to our channel, and definitely share this deep dive with any parent, grandparent, or caregiver who needs good info on kids' health services.
Great point. Thanks for joining us on Have More Babies.
Thanks, everyone. Goodbye for now.